And welcome back. Well, we hear a lot of information about how to keep your heart healthy. Eat right and exercise. Those are two that come to mind, right? But did you know that dental hygiene has a direct correlation to keeping your ticker beating properly? Dr. Robert Montecuto from Wisconsin Smiles is here to make the connection between gum disease and your overall wellness. Welcome back to the show.
Oh, it's a pleasure always to be here.
I love this topic because I think in general we just think about a healthy smile, confidence, bright white teeth, less cavities, but this is truly something that's affecting our heart health, and our health in general is our oral health, right?
Yeah, exactly. Yeah, exactly. You know, last month was Heart Health Month, and so we were going to be here. Unfortunately, we couldn't be here. And so one of the things that we need to understand is that if you have poor oral health, there is a relationship or a connection with problems with your heart. Studies have also shown, for example, that there's an increased chance of getting a stroke. Okay, so having good oral health is extremely, extremely important.
And it can truly affect your overall health other than just your heart as well.
Yeah, there are really a lot of studies out there right now. I mean, there are studies that are actually not, it doesn't cause cancer, but it could be linked to patients with cancer. We had a study concerning toothbrushes in a hospital, for example, and the spread of pneumonia.
Yeah, and you sent that to me, and it's incredible.
Yeah. So what the hospital did is that they decided to buy a whole bunch of toothbrushes and give it to the patients, and had the patients brush their teeth multiple times a day. And what they saw was a really huge decrease.
70%.
70%. Of hospital clinical pneumonia in hospitals, and we all know that clinical pneumonia in a hospital is very, very deadly.
Yes.
And not only this hospital, now veterans hospitals and other hospitals are following suit.
And you know, oftentimes I think we think of touching our eye or something like that. Pneumonia, particularly, they said goes through your mouth. So the toothbrush has truly diminished some of that as well. So I think it's incredible. I've heard before dentists in general can tell almost everything about your health just by looking in your mouth. So this is a very important thing to take care of. Gum disease as well, something a lot of us think about gingivitis and different stages, but it also can, that's what's leading to that poor overall health. So these are the stages of gum disease. What are we looking for here? Well,
first of all, you have different stages. You have just basically gingivitis. It's a little reddening of the gums and stuff like that. Almost everybody has some form of gingivitis. But as time goes by, and let's say a patient does not go, or you don't go to the dentist on a regular basis, bacteria start breaking down food that we eat, okay? And if we don't remove that food, especially underneath the gums, that little sticky substance you get on your teeth sometimes.
I say it feels like sweaters when you haven't brushed your teeth.
Yeah, pretty much.
It feels like you had sweaters on your teeth.
Yeah, and so it solidifies, and it causes an infection underneath your gums and the surrounding substructures that actually hold the tooth together, which are your gums and your bone. And now it creates an infection. And as time goes by, what happens is the infection becomes bigger and bigger. The bone doesn't like it. The gum tissue doesn't like it. So that's where we start losing bone around the tooth. And the crazy thing about this is that it doesn't hurt. Okay.
We may not even feel it.
You might even know you have it.
So what signs or symptoms do we have?
You know, one of the most important signs, if you're brushing your teeth, okay, and when you go to spit out basically and there's blood.
Yeah, or pink tinge or red.
That's a sign of infection.
Okay.
Also, if you notice that your gums are red, they're not pink, okay, and they're swollen or inflamed, that's another sign of infection. Also, bad breath is a sign of infection. So
may not just be what you ate for lunch. Might be your actual gums.
Yeah, exactly. So it's very important that you have any of these symptoms that you visit your dentist. I mean, if you haven't seen your dentist in a while, pick up the phone, give them a call.
Yeah, so what can we do? I love the fact that you brought a water pick,
okay,
this water flosser. Okay, so I told you for Christmas we got a water flosser, which sounds like the weirdest gift ever, but it has been one of the greatest gifts I've ever received. I'm obsessed with it. A couple of our producers, we love them.
Yeah.
What do you really think of it as a dentist?
This is it. We all of our patients, especially those that are going through periodontal or gum therapy, we always recommend a water pick.
Yeah.
And the way you use a water pick, and we were talking a little bit before, it's not to have little water gun fights and stuff like that with the kids, but
I'm going to switch this around so you can see how the water kind of squirts out of it.
Yeah.
There.
So what you do basically is you brush your teeth at least twice a day.
Yeah.
Okay. Floss your teeth, and then you use it after you floss your teeth.
And it's fun.
Yeah, it is fun, especially my kids love shooting each other with it. But what happens basically is that when you floss, because of the anatomy of the gum tissue on your tooth, your floss doesn't go all the way on the bottom to the bottom of the pocket, or the gum pocket or periodontal
Sometimes it
pocket.
feels like it, but no,
yeah,
not doing it.
No, it doesn't.
Okay.
So what this does is that after you floss, put it up against your gums, and it flushes everything out. And the results that we have seen at the office, and most of my colleagues that recommend this to their patients, it's been incredible.
I'm in a second, like I've always said, like, I have soft teeth. I don't know if it's genetic. I'll ask you that here in a second.
Yeah.
I want to know because I feel like our family has just really, soft teeth.
Okay.
I'm very prone to cavities and stuff, and since using that and all that, my checkup has gone better. I don't have any cavities. I love it. Is it genetic to have poor teeth?
Well,
soft teeth.
It's genetic to have teeth that are crooked and stuff like that. And
Okay.
you inherit that from your parents, stuff like that. Bad habits are kind of genetic. In other words,
Learned.
Yeah, exactly. So no, it's really not genetic. It's
Yeah.
just basically having the correct information to be able to take care of your oral health.
It's
And-
so much easier to blame my family.
Yeah, I do it too. So.
Well, here's the deal. People need to come see you. Make an appointment. You can get your gums checked. You get a free gum disease assessment and an intraoral photos. You'll get all of that included when you call right now Wisconsin Smiles. It's 414-982-3676. This offer is only good through the end of March, so you do need to call now. WisconsinSmiles.com. If you've been putting off that appointment, do it now. You will not regret it. And also, do you have these at the office, or can people
No.
just pick them up anywhere?
Yeah, they can pick them up anywhere.
Okay.
They're everywhere.
Get a
everywhere.
water pick.
Yeah, get a water pick.
You will love it. Thank you so much for being here, Doctor.
It's a pleasure.
Appreciate it.
Thanks.